One of the things that really stuck with me from that night was that Professor Snyder said at one point in our discussion that he is less worried about there ultimately being a coast-to-coast, totally autocratic Trump dictatorship that controls everything in the entire United States of America. He's less worried about that prospect than he is that what Trump is doing to the country might pressure us and damage us in such a way that the United States of America breaks up. Because Trump is not just consolidating his power over the U.S. government, he's also simultaneously really breaking the government and breaking the country in as many ways as he can. If the federal government is broken, if Trump effectively destroys most important parts of the U.S. government, if that means in the very short term that Americans are losing data and infrastructure and services that the federal government alone provides, well, one of the things that's going to happen in the relatively short term is that Americans are going to start organizing alternative structures to provide those things some way other than through the federal government. Take, for example, the CDC. For decades, the CDC has been the gold standard of science and health data, not just for this country, but for the world. Not now. You've heard by now that a CDC advisory panel appointed by RFK Jr. Voted a few days ago to roll back longstanding recommendations about vaccinating babies for hepatitis B. RFK Jr.'s Star Wars bar scene hand-picked advisory panel voted to get rid of that recommendation, even though that kind of vaccination is credited with virtually eliminating Hep B among newborns in the United States and saving all the lives attendant in that. Later that same day, that same panel welcomed a lengthy presentation, 76 slides long, about vaccines, a presentation not from a doctor or a public health expert, but from RFK Jr.'s personal attorney, a man who has demanded, among other things, that the U.S. government should revoke approval of the polio vaccine. Because, who among us is not interested in bringing polio back at scale in the United States? 76 slides? Really? Things are weird at the CDC now. That is one of the things that Trump has thoroughly broken. And the closer you look, the worse it is. The Trump administration, for example, very quietly appointed as the second in command at the CDC a former state health official from Louisiana who is credited with halting the vaccination campaigns in that state and promoting quack cures for COVID-19. They installed him as the number 2 official at CDC and then didn't tell anyone they had done so. This is what has become of what used to be the global gold standard health organization, which our country spent generations building. That was the envy of the world. So what do we as Americans do about that? When the authoritative source our doctors turn to, the world's doctors turn to for the best scientific guidance on how to keep us healthy, when that entity can no longer be trusted, what do we do instead? Turns out there's a plan for that, and it's already partially in effect. And a few months ago, groups of states in the West and in the Northeast formed health alliances. They said they wanted to provide their states' citizens with guidance about vaccines based on the best scientific evidence. And they started to do that as states because the CDC, the federal agency that had provided that gold standard scientific data for decades, is now under the control of Trump's brainworms and whale carcasses and psychedelics weirdo anti-vaccine health secretary, RFK Jr. After his hand-picked advisory panel voted last week to roll back a decades-old crucial recommendation on the hepatitis B vaccine, those new health alliances, the state-based health alliances, they rejected the CDC's new advice. Those states are telling their doctors and patients to continue vaccinating for hepatitis B. Just last week in Illinois, Governor J.B. Pritzker signed a bill ordering his state's health department to establish state vaccine requirements for the people of Illinois that will make vaccines more available to Illinois kids, that will require insurance companies to cover them. If the federal government breaks under the presidency of Donald Trump, who else can do this stuff? Who can step in? Former CDC chief Dr. Richard Besser says that if the agency he once ran continues in its current direction, quote, the health consequences will be devastating. More babies and young children will suffer from severe preventable illness, and some will die. He says those of us who care about children's health cannot allow this to happen. Policymakers, physicians, and families, and this is the really important part, must turn to reputable medical and public health groups for guidance. And health insurers should do the same for informing what vaccines they will cover. Turn to reputable groups. What's implicit there is that reputable at this point means not affiliated with the increasingly bizarre and broken U.S. federal government. If states and health institutions and even insurance companies start turning away from the U.S. federal government to create their own health infrastructure across this country by necessity, that's really interesting. It's also a really different kind of country than we have, than the one that we have been living in. Joining us now live here on set is Dr. Richard Besser. He's former acting head of the CDC. He's now president of the very, very important Robert Wood Johnson Foundation. Dr. Besser, thank you so much for being here.
It's great to be here, Rachel.
Let me ask you about the way that I have framed this. So I certainly don't need you to accept that framing, but I want you to give you a chance to push back if you think it's wrong. I'm seeing an emerging need and an emerging development of non-federal health infrastructure in this country in a way that seems to be becoming sort of increasingly official because it needs to be.
I think that's right. You know, I worked at the CDC for 13 years. There's no part of my career I'm prouder of than serving our country as a civil servant. And to have to say that I would not recommend people turn to the CDC for information about vaccines or any other health issue, to be honest, it's absolutely heartbreaking. But what we've seen with Secretary Kennedy is one of the nation's leading anti-vaccine crusaders now in a position to move forward an agenda that is so incredibly dangerous to the health of people. I'm a pediatrician and practiced pediatrics for more than 30 years. And I always told people to turn to the CDC if they wanted to really know the truth, they wanted to know the evidence. And you can't do that now. It's just impossible for someone who isn't a scientist, and even there it's challenging, to sort out fact from fiction.
They don't seem to be basing their decisions, at least around this hepatitis B thing, which I followed pretty closely. They don't seem to be basing it on published data, on peer-reviewed, published of data that other people can review to assess the soundness of their decision. That alone, just as a process, seems like, you know, alchemy compared to chemistry. It just, is there any precedent for that at CDC? Have mistakes of this type been made at CDC before?
No, I mean, there's an intentionality around it. So the presentations that were made at the meetings last week to reach that conclusion were done by people who are anti-vaccine advocates. You know, the traditional way this is done is that CDC scientists who are experts in their field will present the evidence, the benefits from vaccines, the potential harms from vaccines, the information about the disease you're looking to prevent. And then there would be a really robust debate and discussion around what to do, what's the best policy. But here you have a public health strategy around hepatitis B that was working. You know, it had been changed in 1991 because while we'd reduced hepatitis B, we hadn't knocked it out of the park. And so they said, let's vaccinate newborns so that all of those kids who were getting infected when they're really young wouldn't get infected. And so by the time they were adults, they wouldn't develop liver failure, they wouldn't develop cancer. And it worked perfectly. A vaccine that was safe, that was effective, it worked. And here you have an administration that's saying, well, I don't think kids should get this vaccine. And it's like, why? Well, can you tell me that no one has ever been harmed by this? Well, science can't answer the question of never. You can't prove a never. You know, Paul Offit, who's a vaccine expert, says it's like saying, can you tell me a chicken McNugget has never caused harm? It's like, no, it's not the way it works. And so here you have an administration that is looking to take out the whole child vaccine schedule. And they're on the path to do that. Hepatitis B is just the start. And they came in with that agenda, and they very effectively put forward this nonsense that we can no longer support and endorse. And so you cannot look to the CDC for the information. You have to look to these other sources.
And those other sources are going to include states, and they're going to include medical associations.
Yeah, I mean, the Academy of Pediatrics is a great place to turn, but the first place people should turn is to their own doctor, their nurse practitioner, their pharmacist, someone they trust who can help sort through this information.
Dr. Richard Besser, president of the Robert Wood Johnson Foundation, former CDC director. Sir, thank you for being here. It's really good to have you here.
Thanks so much.